Good evening, everybody. All right, good evening. I hear some of you are settling down. I know we're standing room only. We really appreciate the large turnout. So we are going to get started. First, I want to apologize for not being Jim Handley from NBC4. Everybody who was expecting Jim should be down at the Southwest Waterfront. He's been live all night. I apologize. I'm Mark Segraves from Channel 4, and I'll do my best not to disappoint you any further throughout the evening. I do a lot of these events all over the region, DC, Maryland, Virginia. This is a great turnout, and I really appreciate the organizers and all of you for coming out on a weeknight. They wanted me to make an announcement and not forget about it, so I'm going to get that out of the way right now. The Arlington Partnership for Children, Youth, and Families is hosting a community conversation on their new youth survey data on drug and alcohol use. It's going to be November 15th from 6 to 8 p.m. at the Arlington Community Center. So we wanted to make sure everybody got that on their radar. We're going to dispense with any of the intros and bios and whatnot because there's so many people here. Clearly you guys have questions. And tonight is about answering your questions, or at least trying to begin a conversation. So we're going to try to get to that as quickly as possible. There are a lot of stakeholders from the community here to talk about this opioid crisis that the country is experiencing, but particularly here in Northern Virginia, in your hometown. And tonight's event is really a reminder of just how important this is and something that we just can't ignore. And so we want to get to this conversation as quickly as we can. And we're going to begin by hearing a personal conversation. Something I like to do when I go to these community events is kind of gauge the audience. And so just by a show of hands, could everybody who has somehow been touched by this opioid crisis through friends, families, or acquaintances, just raise your hand for everybody here? You know, that's a powerful number, and we appreciate you coming out and learning about this and sharing your stories with us. And we're going to get to a personal story first here tonight, and that is from Carolyn Weems. I'm going to read something here that's been prepared for us tonight. Carolyn Weems was going to share her personal story about how addiction has impacted her and her family, and particularly the opioid epidemic. Carolyn Weems is from Virginia Beach. She's been a resident there for 34 years, advocating for children and families in her community. She attended Clemson University. We won't hold that against her. She married her college sweetheart, Billy, and after they graduated, she and her husband coached tennis, basketball at Old Dominion University, and they opened up their own business, managing, at the same time, their home filled with their 5 children. Carolyn serves on the Virginia Beach School Board, the Southeastern Cooperative Educational Programs, the Board of Directors, and is vice chair of the Virginia School Board Association, the Tidewater region. She's also the co-chair of outreach for the Hampton Roads Opioid Task Force. And she is currently in the process of establishing Caitlin's Halo. This is a nonprofit committed to helping addicts and their loved ones. Of course, sadly, she has a story to tell that we hope we all never have to tell ourselves. And that's about her and her family's life, how it was altered 4 years ago when one of their daughters, Caitlin, died of a heroin overdose. Caitlin, it was described as being kind, beautiful, funny, athletic. She became addicted to painkillers, as so many people in America do, after they were prescribed to her after she had several soccer injuries. Because of their painful journey, Mrs. Weems has been sharing her story at local, state, and national events. She's here tonight to share her story. Please welcome, everybody, Carolyn Weems.
Thank you so much, and I'm so pleased that so many of you have come. This is not an easy topic, but it's one that touches us all. My personal journey through the opioid heroin epidemic. Now, heroin and opioids were not supposed to enter my family because my husband and I did things right. We met in college, we got married, we raised our children, we were involved with their lives, we read to them, we had family dinners, we disciplined them, they had consequences, we supported their dreams, we played with them, we cried with them. So never in a million years would I have ever believed that I would be here talking to you about addiction. But sadly, everything that we did right, none of it really mattered in this case. So this is our story. Caitlin was born, here she is, that cute little bundle, on July 1st, 1991, and she was the fourth of 5 children. And like I said, her family was so excited to greet her. And before she was born, I was working as the head coach at Old Dominion University. And when I was pregnant with her, I told the athletic director I need to stay home with my kids. You know, there's too many of them. And so I became a stay-at-home mom. And then at the same time, we had started our business. But like I said, we were good parents. We were very good parents. Caitlin was a typical child. You know, we loved to go to the zoo. We did everything, you know, with the family unit. She took dance lessons. There she is at the Christmas pageant. And just a really fun-loving, typical little girl. There we are at Halloween. Holidays were a big thing. You know, when I grew up, my family didn't really do holidays, and neither did my husband, so we kind of overcompensated. So birthdays and Halloween and food fight parties and Christmas lights, that's really big at our house. So she enjoyed that immensely. Had a great neighborhood that we lived in, active in the church, friends over. Our house was kind of like the go-to house where everybody came because we have a couple acres on the lake and trampolines and forts and everything. So our house was always filled with kids, always. So I was a substitute mom for lots of folks. I played tennis at Clemson. My husband played baseball, and our 5 children inherited that athletic gene. So all of them played sports. And Caitlin played softball, volleyball, field hockey, and soccer. But about middle school, she kind of decided to concentrate on soccer. She's probably my most athletic child. And I had 2 go to college on scholarships. So, you know, athletics goes in our family, obviously. And I had 1 to play professional baseball. So we know Ryan Zimmerman, the Virginia Beach guy. But unfortunately, she had the back of an 80-year-old. It was something that she was born with. She had a squished disc. So her back started really bothering her in about 8th grade. And so we tried everything. She stopped playing soccer for a while, stopped all the other sports. And then we went to physical therapy for a good year. We had steroid injections. We tried acupuncture. We flew down to Baylor University and got a reflexologist to look at her, and nothing helped. You know, so she said, if my back's, and of course they're not going to do surgery on a 14-year-old. And so, you know, she said, if my back still hurts, I'm just going to, you know, even if I don't play soccer, I'm just going to go ahead and play soccer. So she played soccer and was the best on her team. And then about right around 10th grade, the doctor finally decided to prescribe her heroin. But it was called Oxycontin. So, and it helped. It helped. And that was about 9th grade. In 10th grade, she was playing in the playoffs for her high school, and she went up for a header, and she came down on the defender's head and lost her 3 teeth. So we went through a year of coming to Richmond to a face trauma doctor, lots of pain. It ended up in 9 root canals and the final removal of the teeth because the root canals didn't work. And then the dentist decided to prescribe her more heroin. This time it was called Percocet. Then she went in the doctor for kidney stones in the ER one time. Kidney stones run in our family. And she left the ER with more heroin, but they called it Dilaudid. So before long, my daughter was very addicted to painkillers. Now, we didn't know. No doctor had said, Ms. Weems, you have to be really careful because these are highly addictive. Never got that information. Now, of course, I know to question doctors. You know, now I know that heroin and opioids are basically from the same plant, and they basically have the exact same chemical makeup. They are both very, very highly addictive. One is prescribed and one is illegal. Now, I'm not saying, take opioids off the face of the earth, because some people do need them. I understand that in certain situations. But you don't need 60 and 120 at a time. You don't need 30 at a time. So before we knew it, she was addicted. Now, this had an extreme impact on her family. The disease of addiction, now I know that it's not a disease of morality. And in some cases, it's no longer a disease of choice. It's a brain disease. It's not really all about drugs. It's all about the brain. That these opioids completely hijack your brain so that you have to have them. And once you get that addicted and you have to have the drug just in order to feel good, to feel normal. Caitlin was not a partier. She didn't go to parties. But her body then went through the tolerance where she needed more and went through the dependence, and now she's in the addiction. Her brothers they're all in camo. Our first huge red flag was when her older brother, Beamer, on her right, came home for rehab because he was playing for the Texas Rangers and got hit in the face with a 97 mile per hour baseball. So he's got 27 screws in his face and 7 titanium plates. He took painkillers for 1 day because he just didn't like the way they made him feel, doesn't have an addictive personality, came home after his surgeries in Texas to rehab, and he came up to me one morning and said, my pain medicine is gone out of my suitcase. And that was a huge red flag. So we confronted Caitlin, and that's really when we knew that we had a serious problem. So she was in and out of rehab. We got her help right away. Unfortunately, help is not easy to find. I remember taking her to some outpatient counseling, and she was still, and by this time, of course, I had called the doctor, and I said, do not give my daughter any more of these opioids. And of course, they couldn't talk to me because of her age, and all that. And then I called my insurance company. I said, can I just flag any opioids? No, you can't do that. You would have to drop her completely off coverage. And then I remember going to the hospital one time, the psych center, and she was being assessed, and she was obviously in withdrawal because she was sweating and everything. And so, we were trying to get her admitted, and she's across the table from the assessor, and the assessor says, well, Caitlin, when's the last time you used anything? You've got this long list of, and she was very forthcoming. By that time, she's forthcoming. She wants to get help. She hates what she's, doing to her family and her body. And so she said, Caitlin, when's the last time that you took a pill? And she said 3 days ago. And thus she was in, withdrawal. And the counselor said, well, you don't qualify for our services because you're not a current drug user. And so, I'm like, look at her paperwork. She's actually been here before. She had been there like 3 or 4 times, And so, so I called a doctor friend. He said, well, I hate to tell you this, but you're going to have to try to get her to take a pill or go buy her some alcohol. So I'm like, wow, what a broken system. So anyway, so her brothers and sisters kind of reacted to it differently. 2 were out of the home, and 2 kind of said, get your life together. Her younger sibling couldn't understand why we were always going to the hospital, going to the emergency room. If I thought that she was on something, I would take her to the emergency room and get blood tests done, all that stuff. So it was very confusing for her. And then one of her siblings just wanted to help so bad and kind of enabled her. So you have this whole dynamic now that your whole family is pretty much broken. But finally, Caitlin said, the rehabs there aren't good. And by this time, she was sneaking, and getting pills from her friends. In fact, I told her, I said, why don't you, hang out with Nicole, who's going to be going to Virginia Tech and going to be a doctor. I kept saying, why don't you hang out with her, trying to steer her into, like, good friends. Well, after this is all said and done, I hadn't heard from Nicole in a while, and Nicole was in rehab for pills, and she was actually the one giving them to her. Her dad's a doctor. She's a straight-A student. So I was steering her toward the good friend, not knowing that the good friend was the pill source at the time. So, but anyway, time went on, and finally Caitlin said, this is just not working. I want to go to Tennessee and live with Mama Sue and Gramps. And so I said, are you sure? They live up on a mountain. No one's going to be there. They're 80 years old, And she goes, yeah, because I have got to get away from here and get straightened out. So she went there, and that was the healthiest year she had had in 6 years, in the last 6 years of her life. She completely finished school with straight A's, started learning how to play tennis. My dad, let her join health clubs. I mean, look how healthy she looks. And she was doing great. Unfortunately, she met a guy there at a church function. And his family was very into, his mother and grandfather, into pills and selling them. So she started taking them again and quickly got addicted. She did have a scholarship to college, so I went and got her. And I would go visit her, about once a month down at Mama Sue and Gramps and, check on her. And everything was fine. And this boy, I was like, that's fine, a summer, boyfriend or whatever. Didn't worry about it. So then I took her to college. And on the 12th day of college, she said that she had moved out and she was going to live with this boy in Georgia. And so that's where she lived. So by this time, she got back on the drugs, and he was abusing her and getting her, not to get in contact with us, and taking her cell phone, taking her car, taking everything. And so I told her, I said, it's going to get physical. Again, I flew down there. I begged her to come home, but she just wouldn't. She broke up with him several times and did come home, but always went back. And all her siblings knew by this time she was pretty addicted, because she started calling everybody for money. And so I had told, this is when we had to do the tough love. I said, do not give her a cent, because it's all going to pills. And so they pretty much stood by the tough love. And I tell you, that was hard. She would call me and say, please, can you send me $10 for something? And I would say, no, Caitlin, I can't. And then I would hang up the phone and, of course, start crying that I'm the worst mom in the whole world. But we stuck by the tough love. Well, a few months later, a little miracle came. And she called me and said that she was pregnant. And so I'm not too, surprised at this, but I said, you can come home, but you've got to abide by our rules, and you've got to stay drug-free, everything, and I've got to go to the doctor with you, and you have to be forthcoming, and all that stuff. So she left the boyfriend, came home, and she delivered a beautiful little baby, did not do any opioids, anything, for 14 months. So thank God that she was able to do that for her child. She couldn't do it for herself, but she did it for her unborn baby. So they were both living with us, and then she got back. The draw brought her back again, and she got back into the drugs again. And so we had to do the tough love, and we had to say, you're welcome here in our home, but if you do drugs, you cannot stay here. So it wasn't an angry thing. I mean, she knew the rules, so she moved out in October. And she was still, of course, I was keeping the child, and by this time we had gone to court and settled. I was taking temporary custody because, of course, she couldn't take care of the child. And so she was doing drugs every day and pills, but she was working. And then one day, and she was still asking for money, but, no money. And then one day she called me, and she said, can you please meet me at Starbucks? So I went up there, and she said, Mom, I'm in trouble. I have tried heroin, and I know how strong that is. And so we got her help right away. We tried to get her in a facility. We had to wait 18 days because nobody around there, would take her. A few days after that, she called me because she was still working, and I met her again, and we're frantic trying to get her anywhere. And when she came to the house, she actually came to the house, she just started throwing up, and I'm like, have you done something lately? She goes, no, she was working at Marshall. She goes, I just stole $150 from my employee. And she was so upset because this drug had changed her into somebody that she wasn't. And so I said, well, you need to go back. So we went back to that Marshall. She turned herself in. Of course, they fired her, but they didn't press charges. And so she said, I am so sorry. I cannot believe that this drug, she felt so awful. And so I kept saying, we're going to give you help. We're going to give you help. So she went to a facility. Finally, they opened up a facility, 28 days. She had been in and out of facilities before. But and she stayed for 2 weeks. And then she called me. She goes, I can't stay anymore. All they're doing is pumping me with drugs. And so, if I want to get off drugs, why am I staying here and getting drugs? So I said, well, you've got to have a plan. You've got to go somewhere. So she went to a sober living house, and they kind of took her under their wing, and she was doing great. She was there, and her plan was to stay there for a year, and she was healthy, and you would have never, ever guessed this child was on drugs, because she didn't look like it. And that's the big thing that I want to leave with y'all. The face of heroin is not the city urban person, with needle track marks. The face of heroin is a beautiful girl who loved to play soccer. It's the person next to you in your church pew. It's people in here. It's a military guy who had to handle his pain with opioids. It's the 55-year-old teacher. It's the admiral's son or daughter. It's everywhere. So she was doing great. She called me one night. Her back hurt because she had been working. She's still dealing with this back pain. And I told her, just try to go to bed and, relax. And I'll see you in the morning, because I was going to pick her up the next morning. And that day, we had spent all day together with her daughter at the playground, and we had eaten lunch. And then I had dropped her off at work. And so I was getting ready the next day. And the detective, as I was about leaving, the detective came to my house and to tell me that Caitlin had overdosed and died during the night. And she died alone. She was so embarrassed that she went in the bathroom and locked the door. And I'm sure she was trying to ease the back pain and her stress and trying to go to sleep. And so she did not win her battle. And what I wish that I would have known, and I want to leave this with y'all, what I wish I would have known was that it's not, my kids are not going to get exposed to drugs if you're out there. And if you're a teenager or a parent or a grandparent, it's when are they going to get exposed? Is it going to be elementary school? Is it going to be middle school? Probably. Is it going to be high school? Is it going to be at a church retreat? Is it going to be at a band trip? Is it going to be at a football game? They will get exposed. The other thing, I wish I would have known how addictive opioids were. I wish I would have asked a lot more questions to doctors. I also wish that I would have known that once you start heroin, you don't have a second chance. Even with her in the sober living house, I kept thinking, well, even if she goes back to heroin, we'll still have a few months to get her somewhere and fix her again. Because heroin can kill you on the first time, it can kill you on the 15th time, it can kill you, it is not, you just don't know. It's like a Russian roulette. And then, of course, the last thing that I want to leave you with is the face of this disease is everywhere. And it's not about bad people being immoral and bad people being dumb. It's about good people that come from good families that make mistakes, that get drugged down a hole that they cannot get out themselves. The face of heroin is my daughter, who had so much to give, who was kind, would give her shirt off the back to anybody. In fact, I remember her having a conversation with me before she had tried it. And, she tried it in December, and in April, she's dead. And she said, Mom, my friend started heroin, and once you go to heroin, you never come back. I'm so worried for Megan. And 4 months later, And another thing that I wish I would have known is how prevalent. I mean, heroin is like a different world. I mean, that's just not my world. But they're buying it in bathrooms and schools. It's at parties. It is the drug that these kids are using. It is there everywhere. And you smoke it first, you snort it, you skin pop it, then you are so addicted that you go to the needle. I had no idea of any of this. I thought I was immune. So what I leave you here is a story of a sweet girl who thankfully left me an earth angel. I mean, I'm so glad that she was strong enough to be clean for 14 months. And I want Caitlin's legacy to be one of hope, but mainly one of prevention and education, because you've got to talk to your kids. You've got to have the heroin talk when they're in middle school. Don't be smug about it. But Caitlin's legacy will be one of prevention and education so that kids and adults will not get pulled down that hole, because it's hard to get out. So please, if anything that you hear today, go and talk to your friends, no matter what age, about opioids, and have the heroin talk, because it's everywhere, it's getting worse, and it's going to stay for a while. Thank you so much for listening.
We really appreciate that. We're going to ask our panelists to come up now. Again, thank you so much for sharing your story, and I think it just, really points to how important having this conversation is and sharing these stories, and how everybody in this room was certainly moved by that, and so we appreciate that. So we're going to start off with one softball for the four panelists here to kind of get to know each other, and then we're going to go straight to the audience. There's going to be a couple of people walking through the audience that have microphones. Is that right? One gentleman here has his hand raised. And over here has another. So once we get through these first four questions, you can raise your hand. We'll get to you. Keep your questions brief, and we'll try to get to as many as we can tonight. And we appreciate that. Chief Farr, we're going to start with you, if we could. As first responders, your officers are certainly on the front line of this epidemic. Can you kind of give us, the very grim numbers about what you're seeing as far as a trend? And then how many of your officers are actually trained to deal with these kinds of issues?
I'm trying to see if it is on. I wasn't sure I couldn't hear if it was working or not. So I think what I want to start off with, though, before a little bit of that question is the most telling thing I learned in doing a little research on this over the last few years is who it strikes. And I think your message was probably the most important one here tonight. And some of the stats that we started the poll to give you such perspective on this. When our Office of our criminal investigation teams and the organized crime unit talk to people that have survived through an overdose but not been fatal, and they did it for the last 2 years, I said, how many of you are here because of prescription? And we realized that 90% of the people that we arrested, that we dealt with these overdoses, had been prescribed this drug legally through typical day-to-day things like an accident or an injury. And so for me, the most telling thing about that is it's not some path. You hear through your career, pathway drugs, you hear that they were doing X or Y. It's not that. It's anybody can be impacted by this. Perfectly legal, normal transaction with a doctor for a prescription of an opioid. And so looking at some of the stats over the last couple of years, we've had from 2015 to 2016, our overall events with this have risen 67%. That's a significant spike in a one-year period. Overdoses are up 350% from previous years, and our non-fatal overdoses are up 450%. That's a staggering number in a 2-year period as to the trend that's hitting us right now. The other part of this is sort of amazing to me, and is that it doesn't hit any particular demographic. It doesn't hit any particular part of the county. We looked at every single zip code in Arlington County, except for one. Every single zip code in Arlington County was impacted through either fatal or non-fatal overdoses in the last 2 years. And it's an even split almost. About 15.2% of those occurred south side, and about 13.4% of those occurred north side. So it's telling you it's hitting the entire county. It doesn't make any difference on demographics. It doesn't make any difference on economic strata. The entire county is being impacted as a result of this. The other part that the only other sort of quick stat that I wanted to share to give you an idea on this is that in age, we're looking at numbers that go anywhere from 16 to 66 plus, and every single age category in between was impacted by this. So again, there's no selective group, there's no identified group. The only ones that have the higher percentage are those between 21 and 35, which makes up about 56% of the cases that we take in. But that means the other half impacts everybody either younger or older. So it's pretty staggering numbers for us to take a look at. And that gives you a little bit of an idea of what the impact has been in the last couple of years. Your question about training, of course, the training is unique in a couple areas. The people that work in the organized crime unit, the guys that are back here tonight, have extensive training in narcotics, in narcotic detention, and they work a number of different cases, whether it's in here or out in our task forces. But every single officer has had to get much more training than previous years, because we've come to realize that if you're handling this in an evidentiary capacity, if you're out on the street and you make a stop and you get a hit, fentanyl or carfentanil is so incredibly deadly that through just ingestion through the air could possibly end up being fatal for those that are doing the crime scene. So it's become much more prevalent that everybody in the department is getting training in that regard.
Thanks, Chief. Ms. Stamos, the whole idea of this forum began in the Commonwealth Attorney's Office. As prosecutors, what are you seeing, and specifically what are you seeing that led you to want to, bring a forum like this to the public?
Thank you. Well, thanks, Mark, and thanks for being here tonight to moderate. And thank you all for coming. Yes, the idea for tonight's town hall did begin in my office. And one of the features of my job as Commonwealth Attorney is I get all of the autopsy reports for any deaths that occur in Arlington in the city of Falls Church. And starting about a year or so ago, I started seeing more and more accidental overdose. And you just heard the statistics from the chief. And then police reports of overdoses that didn't result in fatalities. And we were seeing more and more of those reports coming across our desks. And then when we started seeing middle school kids buying LSD on the dark web and taking it to a bathroom in Williamsburg Middle School and taking hits of LSD, we knew we were having a problem. When we saw kids at Kenmore getting Xanax and having kids overdose on Xanax, or a student overdose on Xanax and have to be taken to Virginia Hospital Center, we knew we had a problem. And when we saw kids at Wakefield with LSD and athletes not being able to play because they're testing positive. We have, at Yorktown, the new principal has taken the doors off the bathrooms in order to stop vaping, but also to deter kids from buying and selling marijuana in the bathrooms and other drugs. So yeah, the idea for tonight did emanate from my office, but it was a community effort and a community response to, we have a drug problem in Arlington. We are not immune. We are not, it's not only in Southeast Ohio or in New Hampshire or in parts of West Virginia. So as Carolyn said, this is not a happy discussion, and tonight is the beginning of a discussion. Not one of us is going to sit up here and tell you we have the answers to these problems, but the fact that so many of you came out tonight and that you're here standing around the room to have this discussion is a really good start. So thank you all for being here.
Can I ask you just one quick follow-up? Does the county have a drug court?
We do. We have a drug court, which is, like we say, we're not going to be able to prosecute our way out of this problem. And after I became the Commonwealth's attorney, and Evie Eastman is back here, who runs our drug court from my office, and because of Judge Louise DiMatteo, we have a very successful drug court that works to keep people out of jail, out of the penitentiaries, and using prevention and treatment as the way to redirect their lives. So it's a successful program. We're really proud of it. But it's only one piece of the answer.
Thanks. Mr. Garbow, I hope I'm pronouncing your name correctly. You're a parent. You also have been touched by this. Share your story with us.
So I'm probably no different than many of y'all out there. In fact, I think I know a handful of the folks in the audience. So I've got 3 kids. Elementary school, middle school, and high school. I've been in Arlington all of their lives, public schools. I will tell you that 9 months ago, I would not have been here. I wouldn't have been where you are. I would certainly not have been where I am, but literally 9 months to the day tomorrow, was having a drink and wine and cheese with my wife at some friends in the area. Got a call from my younger children who were at home waiting for us to come back, screaming that the police were outside with my 10th grader. And so we jumped in the car, and as we're racing back, we see 6 police cars fly by us heading to our house. And for the next 48 hours, we went from watching my 10th grader be subdued on the ground. I spent the night in the hospital with him bloodied and almost unrecognizable, chained to his hospital bed. A day later, watching him in juvenile detention facility in the typical orange jumpsuit, and then our first interaction with a court. There's been a lot since, but what I really wanted to do is kind of tell you a little bit how we got to that weekend, because that's not what we had expected to be doing 9 months ago. I think, like Carolyn, we were and we are really good parents. We love our kids. They're lovely people. They bonded well with us. We did great things. They were doing well in school. We had the drug talk, not the heroin talk or the opioids, but for us it was mainly marijuana, pot, and that kind of thing. Particularly with our 10-year-old. And I remember in 9th grade, we knew that these kids were getting exposed to pot and other stuff. And my son, we had a great relationship, and he would tell us, yes, I've been around it or I've been offered it, but I say no, and he's got his whole system worked out how he can kind of say no and not be too uncomfortable. I was really proud of him. And a really great relationship. And then springtime of freshman year in high school, we get a call from a close friend of ours who says, we just heard your son had kind of boasted to his son about being high. So we called our son in and we sat him down, and it was really difficult. Yes, just a week earlier he said he tried pot and it's legal in all these other places, Dad, and I've been, kind of depressed, and this is my new passion, and it's the only thing that makes me feel better, that kind of thing. And he's about to go to summer camp, and we're going to take a family vacation. So we thought we were working through it. And over the course of a number of months, there'd be times when you'd smell it, pot smells. Or actually, here's the clue, not always. And so we thought, we could tell if he had used marijuana. We thought that was it, as though, that was somehow okay. And we thought we had things somewhat under control. He was seeing a therapist. There were some depression and anxiety issues. A lot of kids have those. We were seeing somebody to help with just some substance abuse counseling. Our son was kind of saying the right things, and it got to the point again where we weren't catching him, we weren't smelling it. And then, fast forward to the bloody face and the handcuffs on the ground. What we ended up finding out is that within the first week of trying marijuana, he was doing it daily. Within weeks, he was probably doing it multiple times a day. He began to, I think, do edibles, vape it. Now it's no longer sniffing the laundry or, to figure out whether he's done it. So we couldn't figure that out. We used to, search the house and never found anything. We later learned he was abusing alcohol in the house. He was getting everything, by the way, at school. Most of the purchases and much of the use, as far as we know, was on school grounds. And then we ended up finding out, certainly the day of the incident that I relayed to you, that for the school money I gave him to buy lunch, he'd bought tabs of LSD at the school. And that's what kind of led to the incident. So, for us, it was a wake-up call in many respects. We never thought that we would go through this with our kids, given as healthy as we thought we were. We'd had the conversations. Then we thought, well, we knew everything. We'd had an open relationship, and we sit down and we thought that, well, I guess we've had this honest, open conversation. I look back on it, and I realized there was no way that this kid was going to tell us the truth. The drugs were too powerful. I agree with Carolyn. This is an addiction. I mean, when a kid tries it within the first week, is doing it multiple times a week, something is off. And it was, there's some addictive personality, whatever you call it in the brain. It was not allowing us to be the kind of parents that we thought we were or should be. And there are lots of red flags that I had wished we'd caught. In hindsight, again, the notion that the problem is so pervasive and involving our schools, which is why I think it's so important, at all levels that we have the right folks engaged here. I mean, that was as disheartening a thing as anything, coming from Arlington County, Virginia, to think that my kid has taken his lunch money and it's a smorgasbord in some of these schools. And I know plenty of parents, by the way, whose kids do just great and can say no. And I'm so happy for them and their families and their kids. But I guess my purpose on the panel is to tell you that there are many of us whose kids either can't or didn't say no, and it's a difficult place to be in. There's a lot of resources, but at the end of the day, you can't be a parent to your child if you don't know what your child is doing or being exposed to.
Thanks very much for sharing that. We really do appreciate that. Doctor, we've heard from two parents. You've nodded your head in the affirmative through all of this, like you've, I'm sure, heard a lot of this before. There are high-functioning addicts out there who do a very good job of covering their addiction up. And so tell us, what are the things parents should do and those uncomfortable things parents need to do? And then tell us a little bit, if you can, about the resources that either are or aren't available. We heard Carolyn talk about having to wait days and weeks for an open bed.
Sure, thank you. And thank you all for coming this evening. So before I answer those questions, I just wanted to make a couple of introductory comments about kind of the landscape of substance use. And what I'm going to say is not a surprise to anybody, but I think it's worth repeating that use is common, use starts early, and use is increasingly complex. So the substances that are being used today are not always the substances that we're most familiar with historically. They're difficult to trace, they're difficult to detect in drug testing, and they have very serious consequences in terms of behavior and behavioral symptoms. I know somebody mentioned earlier the risk behavior survey, so for those of you who have not seen it, I definitely would recommend taking a look at it, because it really does highlight the complexity of use that's happening in the schools, including use of over-the-counter medications to get high and use of prescription drugs by children for whom the drugs are not prescribed. So that's 6th graders, 8th graders, 10th graders, and that's all available information and alarming information in the risk behavior survey. And then in terms of impact, I just want to highlight that there's sort of a triad of factors that I think make the impact even more devastating now. And that's that risk behavior for many populations is up. The perception of risk is down for many, including young adults, adolescents who really don't fully appreciate the consequences of use, or may think that they're not vulnerable to use, or maybe not experience the same consequences that somebody else might. And the potency, which is a really key factor, the potency is much higher than it used to be for many substances, including opioids and marijuana. So the fact that risk is increased and people don't perceive that risk to be high, and they're using more dangerous substances, is a very, very dangerous combination. In terms of other impact, I also just want to echo what Carolyn said earlier about the impact of drugs on the developing brain, because this is really significant. So what we know about brain development is that for most humans, the brain does not really fully develop until their mid-20s. The impact of drug use is substantial on the developing brain, including lots of different executive functions, attention, learning. One of the most consistent findings is related to IQ points actually being lower in marijuana users who use in adolescence. So there's lots of impact, and what she said about hijacking the system is exactly right. The reward system gets entirely corrupted by drug use, so that what would be normal rewarding activities is actually no longer rewarding for individuals who are using substances to that degree. In terms of warning signs, I think, and recognition of use, I mean, I think that there are lots of things to be looking out for. I think that the panel has already highlighted some of these, but certainly physical signs, so fatigue, red eyes, cough, sleep and appetite changes. You sometimes will see emotional changes in terms of withdrawal, irritability, family discord, increased argumentativeness, breaking rules, change in school function. That could be truancy, it could be not showing up for school, decreased interest, just a decline in academic performance overall, and then just social factors that could be the clothing that people are wearing, deodorizers, smell, paraphernalia, different friends. All of those things can certainly be indications to ask more questions about what's going on, and the communication piece is really critical. I think it's also important to acknowledge that for some, none of these things may be present, and it doesn't mean that they're not using because these warning signs or risk factors are not present. So really it's about the communication for families, for schools, for providers in the community to really have these honest conversations about use. One of my favorite sayings in AA is that you're only as sick as your secrets. And I think it really does speak to the fact that there's so much shame and ambivalence about having these conversations that it really behooves us all to really have open dialogue, to maintain a curious stance, not be overly reactive, and encourage ongoing communication. There are a couple of online resources, because I know that was one of your questions. So the NIDA, National Institute for Drug Abuse, which is teens.drugabuse.gov, is an excellent resource for information for parents, has lots of information on all different types of substances that are in use today. And then the Partnership for Drug-Free America, which is drugfree.org, similarly has lots of great resources for parents, teachers, individuals who are seeking help. And then I'll be happy to answer other questions.
We appreciate that, and we do want to get to questions. We're going to use our last half hour for questions from the audience. We want to leave you guys at the end a little bit of time, because some of the people who have the tables outside will still be around. We know you want to get to them as well. So we have two gentlemen, one on each side of the room, who, if you just raise their hand, they'll run right over to you. I know everybody wants to be first. Someone's coming to you. And if we can keep our questions brief, our answers will be brief, and we'll get to as many as we can. Yes, ma'am. Thanks.
Yeah. One of the things is that there's so much of pressure about sports that kids sometimes, just to stay in it, even if they're hurting, they go to taking pain medications. And that's an important piece to tell them that, look, it's okay. If you're hurting, you don't need to take the pain medication. You can stay off the game for a little bit. There's a lot of peer pressure going around the sports, and which, I've seen that with, sometimes I'm a physician, and kids are having so many injuries, repeated injuries because of the sports, and then they end up taking pain medications to mask it so they can go back to playing the sport. And it's an important message to give them that it's okay to stay off and not play, and first to listen to your body.
So I know none of you here represent the school district, but do any of you know offhand if there is a protocol in public schools as far as when athletes are injured before they come back? Is there any kind of pain medication protocol?
Well, we've got a lot of people. I see Superintendent Pat Murphy is here. A number of folks from the schools are here. Both my boys played high school basketball, and certainly they have the concussion protocols and those kinds of things are in place. But I'm not sure that there's a particular drug screening that takes place for athletes who have been medicated because of an injury, whether they have to be cleared. I mean, I'm not aware of one.
Just to give the message.
No, it's a very good message. And I think Carolyn alluded to that. I mean, it was a sports injury that caused her beautiful daughter to become addicted. So, I mean, I think a lot of us even those of us who have surgeries and your kid has your teeth removed, or the doctors will say, take this, get ahead of the pain. Get ahead of the pain. I think that's probably the worst phrase the medical community has ever come up with, because, you don't need 30 Percocet pills to get ahead of the pain after your teeth are removed. And I think as parents, we have to moderate what our kids are taking. And I mean, if nothing else, if you go to the doctor and they're giving you the medication, it's, you need to sort of self-regulate that and not even fill the prescription unless you absolutely have to. Life has pain and discomfort, and we can't avoid it. And I think that's an important message.
Did you want to add something, Carol?
Yeah, I just wanted to say the other day I got a call from somebody in the school system that said, thank you, Carolyn, because if we would not have seen your documentary, we would have taken the pain medicine that the doctor prescribed after my son had an ACL, and so we just handled it with ibuprofen. So I think that's, of course, the best way to do it, definitely.
I think we have a question in the back.
Hello. My name is Michael. Thanks, panel, for being here, and thanks for having this meeting. I came down here for a couple of reasons. One is I don't speak for the Department of Homeland Security, but that's where I work. So it was kind of interesting how the city was going to handle this issue. And second, I'm actually doing a paper on this thesis for my school on opiates. And just to throw out another stat that I found online was that 90 people a day die from this a day. And it costs the government $75 billion for this epidemic. So my question was, and I just was online doing this, was, now early in the year, the president established his commission on combating drug addiction and opiate crisis. In July, his commission recommended him to declare a national emergency on this. In August, he himself said it's a national emergency. So moving forward, the way ahead for Arlington, how are you going to, in the long run, try to medically, specifically, I guess, we know how it is in law enforcement, but medically, for the treatment for these people?
Thank you for your question. So yes, it is an emergency, and it's devastating to communities, and it has been in Arlington as well, in terms of the number of overdoses we're seeing, fatal and non-fatal overdoses. There are some things that we've recently implemented in the Department of Human Services to provide more treatment available for people with opioid use disorders. So one of the evidence-based practices is a program called OBOT, or Office-Based Opioid Therapy. And so this is a program that provides medication-assisted treatment, or Suboxone as people commonly know it, in conjunction with a number of other behavioral interventions, individual and group therapy, peer supports, recovery supports, to really provide wraparound services for individuals who are struggling with the disorder. We also are engaged in a stakeholder group, which other people here could probably speak to as well, but it's really a group that's comprised of treatment providers, the schools, law enforcement, really looking at ways that we can respond because there are lots of people who don't ever even come to our front door. So we are seeing increasing numbers of people seeking treatment, which is good that they're seeking treatment, but there are lots of people that we're not reaching in the community. And so we really do need to draw upon some of these stakeholder relationships, work with the hospital emergency departments, work with EMS to really identify these people who are experiencing multiple overdoses repeatedly in the community and who never make it to our office. So we really need to work on those relationships as well. So there are the evidence-based practices that we're implementing in the clinic, in the treatment setting, and then also doing a lot of community engagement work and outreach to really try to find the folks who aren't finding us.
I think we have a question here.
Hi, I have a 7th grade son and a 5th grade daughter, and when my son was in 5th grade, the school resource officer came to our elementary school and had a night for the students and the 5th graders where they talked about alcohol. And several of us asked why we weren't talking about drugs. And we were told that there was not a problem in the middle schools with drugs. And I'm wondering, are we changing our approach now? And will my 5th grader get a different message?
Chief, does Officer Friendly talk about drugs in the middle schools?
Yeah, I believe our officers do talk about that, and our SROs do have programs with the schools. When we put a program together, we work collectively with the schools on the message we're going to take to them. But I know that as I look through here, we talk about substance abuse, and it isn't just about alcohol, and it isn't just about marijuana. We've expanded the conversation beyond that, so that there is a more, I believe, open conversation. We've had in the last year our vice narcotics, organized crime units, detectives have gone into the schools and talked about the things we're doing and the consequences of the action. So I don't think that the SROs are trying to shy away from that. And I can't speak for your previous time, but the SROs that are currently in schools now do invest time in that conversation.
During the parent-child meeting?
No, during training, during school sessions. Now, whether I'd have to ask one of my school resource officers to find out exactly what they talk about in that meeting, but in the normal course of business, in talking to the schools and their health department, I think it's called. To the students, this is through their health and government PE classes, so that's where the conversation is. But when they talk to the parents, I would assume they are having that conversation today about drugs in school.
Carolyn, you wanted to weigh in?
Yes, I know. I've been on the school board in Virginia Beach since 2002, and when my daughter was going through this, I brought up the same thing, and the response was, we don't have a problem, and we don't even have pot in the parking lot. There were like 4 infractions the whole year, and I said, I can go to any high school right now and find a lot of pot smokers, and I'll bring, and so, but it finally took us years to do it, and so Virginia Beach has implemented a whole new opioid education starting in 1st grade all the way through 12th. We're going to be presenting it at the Virginia School Board Association in November. We've aligned it to all the SOLs. Arlington can have our curriculum, and it's done in every health class, and it starts out very, age appropriate, like what are prescription drugs, what do they look like, you never take them, if you find something, give it to a parent, and then by 8th and 9th grade, they are learning the science of it, what opioids actually do to your brain, because kids don't want to just listen now for your, old mom who doesn't know anything to say no. They are really finding what it does to your brain and what it causes. And by 9th grade, we've got assignments, and we looked at one the other day. Kids are doing commercials, PSAs about opioids and heroin, and they're so we've got a great curriculum. Your superintendent's here somewhere, I heard, so you can take it. All the work's been done, and so our kids are getting it at 1st through 12th grade in Virginia Beach.
Superintendent, you just want to raise your hand, so anyone who wants to grab him on the way out has more school-specific questions, I'm sure he's more than eager to answer these questions. I think we have one in the back here now.
And my question's pretty short. I think most of us probably need to know this. I've gotten lots of mixed messages on this. How are we supposed to dispose of those extra pills that are in the bottle that the doctor overprescribed?
Yeah, the Drug Enforcement Administration, in conjunction with all the local PDs and fire departments, every 6 months we'll do Operation Take Back. It's on our website, dea.gov. They'll list all the local addresses, and you bring them to us, and we'll take care of disposal. No questions asked.
Yeah.
And there's more instructions if you. So we do that, but we do the bulk.
Yeah. I know in Virginia,
Basically, if you take your drugs and you mix them up with something like coffee grounds or kitty litter and put them in the trash can outside of the bottle, that makes them, nobody wants to dig through that. You've kind of gotten rid of the problem, but that's how you can dispose of them. You don't want to flush them down the toilet. Take them out of the bottle, mix them with kitty litter or coffee grounds, and throw them in the trash can. That's how you can get rid of those.
I know in Virginia Beach, we've recently established that every police station has a drop box 24/7, 365 days a year. You can go in there. It's very simple. You just drop it in there every time. And there's actually a few CVS pharmacies now in Virginia Beach who are doing the same. So I hope that maybe Arlington will think about that.
There are also, just so you're aware, there are also inactivation kits, many of which have been distributed through the Virginia Department of Health. So we have some of those at the Department of Human Services. Many pharmacies will hand them out for free, and they're basically envelopes that contain chemicals which basically will inactivate the medication, so you just mix them in water and then dispose of them.
Next question is right here.
Thank you all for being here. Can anyone speak to what is going on within the medical field to prevent physicians from even prescribing or over-prescribing? Can people speak to systematic changes in that regards, as well as alternate forms of pain relief?
I can speak a little bit about that. So yes, in Virginia and in many states, there have been new regulations and restrictions around opioid prescribing. Particularly the length of time that you can prescribe medication for. So whereas it used to be 30 days, unlimited amounts of pills, there have been a lot more restrictions on the length of time for which you can prescribe opioids. There also are now new requirements for medical providers to use a system called the Prescription Monitoring Program, which exists in Virginia and most other states as well. And so as a provider, if I'm going to prescribe a controlled substance, I'm obligated to check a centralized registry, which basically looks for any controlled substances that have been filled at any pharmacy. And it actually now also includes pharmacies from DC and from Maryland. So it actually is very helpful to be able to kind of cross-check any sort of controlled substances that are being prescribed by providers in the area. So those are two examples.
Well, and John, the PMP for that particular patient. So a patient, if they just got 30 things of Percocet the day before, and they want to go to another doctor to shop for more drugs, that physician could look to see that individual, right,
That's
was already
exactly right.
prescribed 30 pills of Percocet or oxycodone 2 days ago. You don't need another 30 4 days later. So that is in place, and hopefully the medical profession and pharmacists are using it.
So can I just clarify, so is that incumbent upon the physician to follow? Because if we go and we try to buy Claritin, I have to show my driver's license, and even if I go out of state and I've reached my limit, that pharmacy in Florida knows that I've reached my limit in Maryland. Is that system not the same for this? What you're saying, the system is not the same for opioids, and it's incumbent upon the physician to make sure that they're not shopping doctors?
I mean, the pharmacy has the ability to check that same system as well, but it's, yes, if I am the prescriber, I would check the system, or I would have a delegate check the system before I wrote a prescription for anything that was controlled.
I think we're on this side of the room over here now.
Thank you. This has been a fantastic forum, especially for highlighting the problem. I'm just curious if, given all of the statistics and the stories that we've heard, if there is someone from APS here, if Dr. Murphy's here, if we could maybe hear a response about what the schools are doing and how they would potentially highlight and incorporate parents into that response. I have elementary school kids. I would love to know, what am I supposed to be saying to my kids so we can prevent this in the future?
We'd love to have
We can bring a microphone to you right here. Or you come right on.
There you go.
I don't normally share my microphone, but in this case.
Well, good evening. It is a pleasure to be here. I want to thank the panel for the work they've done in pulling this together. I do want to say, Carolyn and the APS parent, I'm sorry to hear your stories very much. And I also appreciate the fact that you've been willing to share some of your experiences with us. I know we have several other individuals here this evening from APS. I think one of our messages is first about education and awareness. And there are a host of different things that we do throughout the curriculum that reinforce that message. I would ask if you have questions about that and you want to know more details about that to speak directly to your principals. I'm sitting here with our CCPTA president who has taken on also the advocacy to network this through many of our PTAs, and we are working very closely with many of our secondary, middle, and high school PTAs to get that message out. Folks, we walk a fine line, and I want to bring this to your attention, and I feel strongly about that. The message I want to send to you tonight is one of education and awareness and prevention, but it is not one of prosecuting students or bringing them forward. And so how do we do that so that we help children and support them when these things happen that are very unfortunate? And as you've heard, this is something that is a disease, but we need a partnership. I will tell you that. I came here in 2009, and in the spring, I sent home a letter in prom season, and I said, I need your help in talking with your children about prom and graduation season. I need your help with alcohol prevention. I need your help with them partying. This has got to be a partnership. None of us can do this alone, but the reason I'm here tonight is to send a very clear message that we're in this together. This is only the first step. You're absolutely right. Schools do a host of things. It's only, though, one part of the puzzle, and if this raises the awareness, just like when we got some pushback about bringing the canines in, then I advocate for that. And so does that make us feel uncomfortable? Absolutely. But in light of what stories these parents have had to share with us and some of the pain that they have experienced in their life, we need to come together collectively as a community and say, where do we want to be? And how do we want to get there collectively? So I need your help, and we can't do this alone. And so that's my message this evening. And there are a lot of things that are underway that I think will get us there. So I really look forward to the conversation continuing.
We appreciate you rolling with the punches there for us. Thanks very much. Our next question's over here.
I'm a nurse practitioner in oncology, so you can imagine I prescribe opioids. And this is an important conversation, and my daughter was offered 3 Tylenol with codeine for a headache at a baseball game. So it is shocking. But I also want to remind people that if you have a loved one with cancer, it is crucially important to control that cancer pain, because if you don't, their quality of life diminishes. At the same time, if you therefore by necessity have to have opioids in your house, you need to lock them up. It is shocking how long they hang around and how they sometimes disappear. And it's really important to lock it up, and it's really important to get rid of them when they're not needed. And they will not take them back at our pharmacy. And I think CVS only knows what other places a patient has tried to get drugs at another CVS. I don't think they know if it's at another Rite Aid. So you might want to check on that. I'm not sure, but I don't think it always works.
Let's go over to this side of the room.
That wasn't a question,
Sam. I'm here on behalf of the Arlington Troop 647, and I'm wondering, what can kids do to spread awareness about drugs?
Maybe one of the parents want to answer this. What you think your kids can bring the same message that you're bringing tonight?
I I thought we had spread awareness in my family. So I mean, I guess I think it's great that we're talking about education and awareness and dialogue. Honestly, it failed a little bit in our household. We had those conversations. Our kids, we thought, were aware. We had pretty in-depth conversations about all aspects of it, I thought. For me, the better question is, well, once you're exposed, or God forbid, once you try it, then what, right? What's the recourse? What's the conversation to have afterwards? So it's a great question, and I just feel that it's tough to be too reliant on awareness. I mean, I think one of the things that certainly helped our own family, which is a little bit of, I hope, what this is about, is being exposed to the consequences of the problem, seeing other families, for kids to actually hear perhaps from others of their peers who have made those mistakes, who have had the same conversations, but made difficult or bad decisions in their lives. I just, my own experience is oftentimes that is a more powerful message and received in different ways than what we tried in our own household. But it's a great question.
Chief, let me ask you, on behalf of this young man, if they want to approach a school resource officer, what is the protocol there as far as confidentiality and just a young student wanting to be able to have a conversation like this with a school resource officer?
The SROs are in the schools for the primary reason to engage in that community. We're not there for enforcement. We're not there to be the police of the schools. We're trying to have that dialogue all the way through. And to listen to his question, there's going to be a lot more weight with his peers when he does talk to that SRO. He does have an appreciation. I can guarantee you the SROs will listen to him. They'll answer him honestly, and they'll help him with a response to that. But it's one thing for the police to come down to a classroom and suggest ABC. I think there'll be a lot more weight if that young man goes back and says, I talked to the police, I believe what they're saying, and let me share the story with you. So I would encourage them to talk to us at any time.
Thanks, Chief. Let's go back over to this. Here we go, right here. Thank you.
Hi, I just wanted to ask, first of all, as far as transparency, I know a lot of us are parents here in the room, and I'm kind of a little disappointed that APS wasn't up talking about what they're doing in the schools, especially since the kids are getting the drugs in the schools. They've got cell phones. They're saying, hey, meet me in the bathroom, it doesn't sound like also, I just found out my kid is now a freshman at Yorktown, and I was literally shocked by the numbers, because I actually have seen the youth risk behavior, and I've gone to some of these substance abuse, and I think if you're a Yorktown parent, you will be shocked at what's going on as far as drug use. And, I wish that for many years that I would get a report, maybe quarterly, yearly, whatever, that would tell me overall what's happening as far as drug use in the schools, how many, kids were caught with drugs, how many assaults were there, how many of those kinds of things, so that the parents actually have an idea of what is happening in the school. The transparency is what we need, because you know what? Even if I look around at this number of parents that are here, it's a drop in the bucket as to how many parents there are in our school systems. So they're not going to know necessarily, all of these statistics and things like that. The school's certainly not sharing it very much, or if they do, it's with the PTA meeting that's hitting, 15 people. That is not transparency, and those information needs to be out on the websites regularly. I would love for the police officers to provide those reports regularly to the parents. I hope that the school will come forward and let us know what they are doing to protect our kids in the schools, so that we know, not just the education, but what are they doing so that my kid can go to the bathroom and not be worried that somebody's vaping or whatever, because they're kids that are holding their pee, because they don't want to go to the bathrooms.
All right, thanks very much. We got another one in the back here. Let's go to the back of the room. We only have a few more minutes, so if we can just get to the questions real quick, answers. We're going to get a couple more here before we have to break.
Mine's a two-part. One, there was parents asking about education. Red Ribbon Week is every October from October 23rd to the 31st, and it actually has a school program. They don't even have to work at it. They pick up the guide and they read it. And if you turn around and you look at Operation Prevention, they will give you the science behind addiction. You've got questions and you want references, go to their website. And the second part is, nobody's brought up Narcan and what Dr. Levine did last November with a state of emergency, allowing people to walk in. Can you explain Narcan and how easy you can get it now, what it does, and why?
Doctor?
Sure. So Narcan is a opioid blocker. Basically, it's used a lot in the field to reverse overdoses. So if somebody's overdosed on an opioid, naloxone is either injected or administered intranasally to basically reverse the effects of opioid. And it's life-saving in many, many situations. In Virginia, they have basically issued a statewide prescription so that anybody can go to a pharmacy to get a kit with Narcan, and that includes family members, loved ones, and when in our sort of treatment practice, when we're working with individuals with opioid use disorders, it's common practice for us to try to make sure that individuals who are connected to that person have Narcan available to them to administer in any kind of emergency situation. So it definitely has become much more available. We are, as a state, also working on training to provide training on the administration of Narcan. It's not particularly difficult to administer, but providing training to parents, loved ones, community stakeholders on the administration of Narcan, and that will be happening in Arlington actually within the next couple of months, where we're going to be starting a series of providing trainings for the lay public.
Stamos, did you want to weigh in on this?
I just wanted to make the point that APS was a part of the group that caused tonight to happen. So, the transparency issue is important, and our superintendent is here. And I think the fact that there are members of the school board here, I think we have a number of elected school board members. I see Reed Goldstein. I think Barbara Cannon is here. Our candidate, one of our candidates is back in the room, Monique O'Grady. I think today's participation of APS is an acknowledgement that we have a problem, and they know that. And I'm not trying to take up for APS, but APS was involved in the planning of this event. They realize what's going on. They're a partner in trying to get to the answers. So I think you're going to see some changes.
We're going to get our last question in here before we have to call it a night.
I just want to point out in terms of APS that APS also sponsors, in conjunction with treatment providers, middle school and high school substance abuse counselors, Arlington Probation, Office of the Public Defender, and the Commonwealth Attorney's Office, a program in the public school systems called the Second Chance Program. Kids can go get 3 days of drug education and hopefully some prevention. Kids can get that with an excused absence from school. It can be referred from the courts. If they're already in trouble, it can be referred from the school to avoid disciplinary issues at school, and it can be a parental referral. That is, if you think your child in the schools is starting to get into drugs or is starting to get an issue, you can actually ask that those kids go to the Second Chance Program through the Arlington Public Schools. And for those of you who don't know about it, now you do.
We want to. I know everybody's got a lot of questions, and I think as we said in the beginning, this is just the beginning of an ongoing dialogue. There will be more of these forums going forward. We want to remind you at the Fairlington Community Center on November 15th from 6 to 8. They're going to be discussing the survey results. There's still some presenters here that have tables that'll be here for a while. I want to thank all the panelists, and I think everybody's going to stay here too. So if you want to try to get some one-on-one time, you can. I want to thank the panelists, particularly the parents, for sharing their stories. Thank you all for coming out.
We could have gone home.
I thought I was going to get a last comment.